You know, I don't think that this is a problem also with creating an advocacy group. I think not enough patients would be willing to self-identify as psychogenic to participate in something like that to begin with, so I don't know those levels. There are suspicions, and there are articles written that suggest that, oh, these patients tend to be less educated from a lower socioeconomic status, but then there are other articles that say otherwise, that these are nurses and physicians that also get these disorders. So I'm not sure what that is. I do know in the movement disorders clinic, they're often used to seeing certain kinds of patients that are older, and so when a younger woman comes in, and I've also tried to identify with physicians if there's a stereotype, you know, so, and there tends to be, and some have given me very detailed stereotypes of the kind of patient they think that comes in actually it's been interesting, they say they kind of just have a sense or intuition within the first few seconds whether or not the patient is psychogenic before even having seen them in the office. So I think that that's a little bit dangerous in that, like I said, in the VA, we're taking 5 times as long to identify patients as psychogenic because we're not anticipating that these big burly men coming back from war are going to have psychogenic, you know, paralysis or something like that. So it's something that needs to be examined. But yeah, demographic information is still more of it's needed.
Is there any data on whether or not people with the same psychogenic presentation were treated with different types of placebo, and whether one type of placebo was more effective than the other? Because, I mean, you would predict, right, if the placebos actually have a physiological effect, you should see some separation in terms of what type of placebo is more effective in a particular disorder. And if you don't see that, then it says that the placebos probably have no physiological effect, and it's also psychological.
Yeah,
perhaps.
Well, I would love to see that kind of study done. No, there have not been studies. They're exploring extensive clinical trials or anything. There haven't been clinical trials for any medications for psychogenic disorders, much less something placebo. But also I would hesitate to use it's just psychological because that's what I'm talking about. I think this is a problem. There's no bright line defining neurology and psychiatry anymore. The more neuroscience illuminates mechanisms of the brain, we find that we have to challenge our assumptions about that because we kind of use these terminology in passing but don't realize all the heavy weight of the assumptions that come along with that. So it's something to be cautious of.
So if you give a patient, say with psychogenic seizures, if you give them a real drug, an anticonvulsant drug, does it work? As well as placebo? And if not, why not?
Yeah.
You know what I mean?
This is such a classic David question. It's a really good one. Yeah, actually, that's interesting. So why shouldn't the placebo act as a placebo in that case, right? So the real drug is the placebo in that the real drug, which we shouldn't have to say.
Yeah.
Actually, many of these patients, there's 2 things that I've heard happen. One is the patients don't respond to those drugs, epilepsy drugs. So they either try them on a whole host of them, and then they say, okay, well, none of these epilepsy drugs are working, so likely, you know, you actually have a psychogenic epilepsy. 2 is there are some patients who actually, there's a story I know of where a mother brought her son in, and she would always look forward to giving him new drugs because he always experienced a placebo effect off of the new drug in anticipation that it might work. So I think there are 2 different things that happen there.
But I guess my question is, so suppose you have a patient where, like some of the movies you showed, where you're giving a placebo and the placebo is working. If you replace the placebo with a real drug, what would happen?
Oh, I see.
Yeah.
Yeah, I mean, it could work. And actually, I guess I should point out that so AMA explicitly prohibits deceptive placebo use. And AMA means placebo is something you believe is not physiological active. So many physicians I've talked to use something that they call active placebo, where they use subthreshold doses of real medications, and that seems to work. But yeah, that you always do that good inverted thing. That's a really
but I guess that's what I was asking too. I mean, you know, there are all different types of placebo, right? I mean, you mentioned vitamins, but there might be some conditions where there's some underlying cause where a vitamin might actually be protective, right? Or I'm sure acupuncture causes certain brain regions to be activated I guess it's the same thing, right? It could be in that case the anticonvulsant wasn't addressing the true cause of the problem, but the placebo, by whatever effect its acting might have been. And that's why, I mean, I think it would be interesting to see if all placebos are the same or some group and some
Well,
group.
and I think it might be dependent on the person. So, you know, what are the person's, you know, reward pathways like? What's their expectancy like towards drugs? We know that patients who have had favorable experiences with pills over injections will do better with placebo pills. You know, those who favor injections will have better with saline injections. So that's even outside of the symptom, just the patient personality can be that. And it can be, you know, when I talk about context, it could be with a different physician, you might have a different placebo effect. So there are a lot of variables.
Yeah.
Okay, go ahead.
Yeah, so there's another, so let's just say it is a psychological effect that involves brain networks, just like, say, there's a depression network in the brain, there's a placebo network that is a very specific set of structures and transmitters that are involved to make the placebo effect work. That should be manipulatable by another set of drugs, let's say placebo effect enhancing drugs that really do change the physiology of the brain, say the dopamine release probability in the mental stratum, and that would actually help the placebo effect to work better in a sense, because it would sort of pre-activate the placebo network. Is any development or any interaction of psychotropic drugs with enhancement of placebo effects?
I think I'm just going to keep everybody in a little right grant. But no, nothing like that. But it's a great idea. No?
Yes, and the point about coming back on the point that David mentioned about giving them the drug that is supposed to be good for the symptom. Maybe Thomas can comment on that. So if you have a so-called psychogenic person coming in with symptoms of Parkinson's disease, and they believe they have Parkinson's disease, but obviously the neurologist, by examining the person, knows that this is not Parkinson's disease, it's psychogenic. But go ahead and give levodopa, which normally works particularly for if this Parkinson's is going to work. I don't think they respond. Is that the case? Am I wrong with that, Thomas? Or are they going to respond?
Well, you would have, no, they would not respond. Actually, if they respond, you would conclude that this was a case of unusual Parkinson's. So it's just a matter of definition.
Actually, I have physicians who have told me that they have given drugs and it works on psychogenic patients, and they show they ordered a PET scan, they didn't have any dopamine loss, and it worked. Worked.
That's very controversial. That's very controversial.
Probably this should be the last question. Can I talk to you afterwards, since it's a new...
So am I thinking about the placebo effect in the right way here then? I was kind of assuming that with any drug treatment, you were getting the placebo effect in addition to whatever the active properties of the drug, like the known properties of the drug, right? So it would, you know, if you're given an SSRI or something like that, you know it's a drug, you expect it to work, you get a placebo effect, right? In addition to the drug effects on top of that. Is that not correct, or because from what people were talking about before, I mean, it seems like if you give someone with psychogenic Parkinson's, let's say, you know, L-dopa or some drug, you're going to get the placebo effect that may be enough to, you know, to have a beneficial.
So you're asking, doesn't every drug have a placebo effect inherently built into it?
Right, exactly.
And maybe. I mean, I think it depends on the patient. This is something important too, is that not every person is going to be susceptible to placebo effects. So it would depend on the person. But maybe if you want to generalize, I suppose there would be, but the individual maybe not. Okay, well, I think I can answer questions afterwards if you want to come talk to me. I have my business card up there, but thank you very much for all your wonderful questions.